The Health Insurance Act is a legal document that defines who is covered and what is insured in Ontario healthcare. It dictates what hospital services are included in the Ontario Health Insurance Plan. This includes physicians, nursing, midwifery, and dental services within its definitions.
The Act defines that every person who is a legal resident of Ontario is entitled to be insured by all that is covered under the Act. Those who are dependents are covered under their insured caregiver. These individuals include children under 22 and anyone who is dependent due to a mental or physical disability. It is the responsibility of the health user to remain insured. Each person will be issued a health card for identification, which must remain up to date.
This act entitles insured individuals to care outside of Canada if it is medically necessary and the condition developed while abroad. Under the Health Insurance Act, the insured client is covered for drug preparations and biologicals that are deemed necessary by a primary care provider, hospital stays and services, including operations, diagnostic and screening tests, ambulatory care, and ultrasounds.
A midwife is defined under this Act as someone who is registered with the College of Midwives of Ontario. Midwifery services that are covered for insured persons include any prenatal care, labor and delivery costs, postpartum care for the parent, and newborn care. Coverage is provided anywhere midwives practice, including hospitals, birth centers, and home care. Midwifery services are also covered under the Act for uninsured clients within their catchment area. However, only the midwifery costs are covered, and therefore tests, ultrasounds, consultations, and hospital care are not covered, and these expenses must be paid out of pocket.
There are several reasons why someone may not have access to health insurance under the Act. Landed immigrants who are new to the country and are here legally are subject to a 3-month waiting period until they receive their OHIP. Uninsured or undocumented clients are people who are here without legal status, such as refugees whose claim has been denied, or people here on a visa that is expired, and these people do not have health insurance coverage. Obstetrical tourists are also not covered, and these are people who have come to Canada with the intention of having their child here then returning home. They are expected to pay for all their care in full because they are not the intended recipients of uninsured funding for midwifery clients. The final group who may not be covered are those who have opted out of insurance due to personal or religious reasons.
Midwives do not have an obligation to report to immigration. Therefore, those who are not insured have access to midwifery care without fear of repercussions. However, midwives do have an obligation to report if there is suspected insurance fraud occurring. Overall, the Health Insurance Act provides those residing in Ontario with health insurance and coverage for certain services. It has midwifery-specific sections and directions for those who are uninsured. There are many sections to this document with lots of important information, but this has been a summary of the main points relevant to midwifery.